Men's health matters at every age, from annual checkups and preventative screenings to healthy habits like exercise, proper nutrition, maintaining a healthy weight. Small steps today can lead to a healthier tomorrow. Dignity Health Medical Group Arizona is committed to helping you and your family stay healthy through every stage of life. Dr. Tempe, thank you so much for taking the time out of your busy schedule to have this important conversation today.
Thank you for having me. I appreciate it.
All right, so historically, men aren't really proactive when it comes to taking care of their health. What are some of the significant reasons for those who are active in taking care of their health?
One of the most significant reasons is that it can increase your lifespan. On average around the world, men tend to live about 5 years less than women. And this gap in lifespan is largely due to preventable causes. Things like high blood pressure, diabetes, heart disease, and certain cancers. Fortunately, these risk factors are very responsive to prevention and early intervention.
What age should patients be looking into preventive healthcare screenings, and what type of screenings should they be requesting?
One of the key starting points is just getting a primary care doctor, because over 2/3 of men don't have one. Preventative screenings can typically start as early as age 18, depending on individual risk factors, but by 35, it's generally recommended to get at least a general metabolic checkup, looking at things like BMI, blood pressure, diabetes risk, and heart disease risk. As we kind of approach our 40s and 50s, we really start to look at screenings for cancers. So the ones that are really important is at age 45, getting colorectal cancer screening, and then at 55, having a discussion with your doctor regarding prostate cancer screening. For men who have a history of significant tobacco use, we also think about kind of 2 additional preventative screening tests for cancer. So at age 50, we definitely want to get lung cancer screening done. So obstructive sleep apnea is essentially when we stop breathing or have really shallow breaths when we're sleeping, and it largely has to do with kind of tissue architecture. It relates to weight in that as we gain weight, there's a higher chance that our airway is obstructed by basically our neck tissue. The reason that's important is obstructive sleep apnea independently increases our risk of hypertension, diabetes, cardiovascular disease, and decreases our lifespan in general. They also tend to interplay with one another. So the higher our weight goes, the worse the obstructive sleep apnea can get. The worse the obstructive sleep apnea gets, the worse our weight gets. And that's mainly due to when you're always feeling tired, due to obstructive sleep apnea, you're not going to engage in physical activity. Your hormones are actually going to get unbalanced, and your metabolism is going to be disrupted.
What type of lifestyle habits should men adopt to really take care of their health moving forward?
The best things to do are going to be very low tech. So being physically active, eating healthy, managing your weight, avoiding tobacco and alcohol, and engaging in your own mental health are going to make the largest impact. Just by doing those things, you add on up to 9 years onto your life without chronic disease, and you can reduce your risk of mortality by about half. So all of these things, even though they sound very simple, they're not very extravagant. The consistency in them is what leads to health over a lifespan.
Your health journey starts with one simple step, and today is a great day to take it. For all the men that are watching this incredible segment that we just had, including myself, where can we go to learn more information about all the resources you guys offer out here?
One of the best places is just visiting dignityhealth.org, or even stopping by our clinic here in the East Valley. So we're the family medicine clinic in Gilbert.
Dr. Tempe, I greatly appreciate you taking the time to have this important conversation about men's health. Thank you so much.
Thank you so much for having me. I really appreciate it.
Thank you. And if you guys would like to learn more information about Dignity Health, you can go to the website or call the number you see on your screen.